We continue to discuss health matters that are physical as well as of mental. Now, suicide is the act of intentionally taking your own life. Suicidal feelings can mean having abstract thoughts about ending your life or feeling that people would be better off without you. Or it can mean thinking about methods of suicide or making clear plans to take your own life. As we continue celebrating the festive season, not everyone is celebrating due to various reasons. And to educate us more on the topic of suicide is general practitioner, that's Dr. Cornelia Ndifon. Doctor, very good morning. Thank you so much for being here this morning.
Good morning to you. Good morning, the NBC crew, and good morning to listeners. Happy New Year to all of Namibia.
Very much. Of course, what are your wishes for Namibia this year? As a health practitioner, what would you like to see for our nation in this year of 2024? Yeah?
Oh, I have great expectations for Namibia. Yeah. I'm wishing that the health of Namibians, let's start from there as a medical doctor, that the health of Namibia will be much better, compared to last year.
Yes.
And that the economy of Namibia would improve because both the health and economy can play a part in those people who unfortunately would think that taking their life is the best option.
Very much.
So if the economy improves, then maybe we are going to see less of threatening situations that will make people think of
taking their own lives.
Yeah. Very
much indeed.
Yeah.
And that's, of course, our topic for this morning, suicide, Doctor. We know that it's festive period, and as you rightfully said it, while many are celebrating, many are not sharing in those joys, many people are going through things, be it trauma, be it issues of, social standing, etc. Just what do you make of suicide, especially during this period? Yeah.
Okay. Thank you very much. I don't want to really say that suicides are highest in a particular festive season, and not to look at Christmas per se. In the course of the year, we might, in fact, after now, we are going to talk about Valentine. And after Valentine, we'll move to Easter. There is a possibility that around these festivities, when people who have had a particular experience that puts them at risk, then festive seasons can be threatening. Like, I don't have a relationship. What is Christmas for me?
Exactly.
I don't have a relationship. What is Valentine? I don't have a father, or they don't care.
Well, what is Father's Day to me?
Yes,
exactly.
all of those things. So it may not be specific to a particular festive season, but if we go back to look at the data, like in Namibia, unfortunately, a suicide is always like a coroner's case or a police case. And so the primary data might lie with police.
True.
And so we may need to go and look and see, are they more just before Christmas or just after? Like, we know that January is a very tough month, right?
Yes.
And because of festivities, people just want to live in that moment. And then you never know who will exhaust their finances. And then come January, reality hits on some people. And then they think, oh, I was thinking and planning and hoping. And things haven't materialized.
Exactly.
And then for some people, they want to end their life. And emphasis, some people. The people who actually effect that is the way they interpret their situation. Many people will face financial crisis over the course of their lifetime.
Their lives,
but not all of them even dare to think of suicide, let alone acting it through. So people experience loss of relationship, loss of finance, loss of a loved one, bullying, but not all of them go to think of suicide. Those who think and effect suicide is based on their interpretation
True.
of that experience.
That experience. And that's, of course, where, people vary as individuals. But how do you, for instance, you find a situation where people seemingly look like they are doing better. Oftentimes you would hear, oh, he was just coming around, or she was just coming around, and then she took her life, What do you think happens in that period where someone seemingly is doing better, is getting out of this ditch, but then, they take their own life, and it always leaves families confused as well, yeah.
I am also not in full agreement with that because it is us assessing that person.
Also, yes, very true. Yeah.
You cannot tell a man's mind on the face.
Yeah.
So we are saying, oh, she looks okay, he looks okay, sounded good.
Yeah.
Now I've just heard that he or she has passed. What I want to say is that they probably were not okay.
Not okay.
Because if they were okay, they would not. And for the person that truly has a plan hashed out, in fact, they might actually be deceiving you.
True.
So you go away feeling that, oh, he was thumbs up with me. She was looking great. She was smiling, but that smile could be a facade to push you away from probing.
True.
It is possible that they may look okay, but then it's like somebody who takes alcohol and feels that if I get drunk, my problems will go away. Then they are drunk, they fall on the roadside, and after a while, whether somebody picked them or not, they will still arrive home. When they arrive home, the problem is there. Are you getting me?
Still waiting for you.
It's still waiting for you. So the person who apparently seems okay to us, I'm saying there are two possibilities. We are the ones saying that they look okay, but they are not. The other side is that they are really trying to effect their plan, and so they don't want you to stop them. So they may be pretending to be okay. And this we must have on the back of our minds if we are really going to reduce or eliminate suicide, if that is possible.
Yeah, absolutely. I know that we've made a lot of strides as health professionals, as counselors, as government, etc., in providing services to these people. But we know that there's still a lot of need out there. When you look at these numbers, over 600 people committing their lives, taking their lives. It's terrible. 80% of that being men, etc.
Yes.
We know the ratio of counselors to patients, etc. We need to capacitate still. What would you like to see during this year from a health professional's perspective, supporting people who are having suicidal thoughts here?
Okay, thank you so much. So, I am operating as a clinician and as a public health expert. So, the typical medical school training is to sit and wait for disease to come to you. Okay? So in that sense, if I'm seeing my patients or any doctor, you say next. Is that not what we do from the queue? Next. When a patient comes in, we were taught in the medical school that you start examining your patient as they enter through the door. What is examination? Facial expression really speaks a lot about mental health. And so if it happens that the patient you are talking to looks sad, for example, then try to say something about that situation you are looking at. Maybe the person has a nice suit like you, and you're like, oh, your suit is really nice, but the reaction is indifference.
Those are some of the telltales.
Little things. You might even maybe the person has one complaint, but as you're looking at the face, you see a black eye.
Exactly.
What does a black eye say? That is sign of abuse.
But oftentimes, unfortunately, doctors never have enough time. They're always in a rush, always impatient, so to say.
I agree with you.
So we need to be patient as well as medical practitioners.
We need to be very patient. Yeah. I know sometimes in the public sector, the volume of patients is so much for that particular doctor. And you just hear, like I was saying, next. But at the private setting, there is more room to take time, observe your patient, listen to what they are saying. When you observe, like I said, you may see a black cheek, you may see a black eye, you might even see scratches, you know, funny injuries. Don't just ignore them. And sometimes they start with a complaint and they deviate. It's like they don't want to go to the court. But if that facial expression, which is very important, if it is looking a bit odd, try to say something. I remember I was just talking to a lady who was like, I'm having a lot of body pains, I cannot sleep and whatever. But even though I smile, she wasn't smiling. When she has finished saying everything, I said to her, tell me the truth, are you happy?
And you see, and usually with
and she said no.
Wow.
But she was talking about leg pain, she was talking about that, and I just said, are you happy? Because the way I'm looking at you, it doesn't seem like you're happy. So we need to probe. We need to probe. Now when we probe and the answers are directing us to some mental health issues. Mental health is very broad. Then please, let's not be in a hurry. We should dig deep. Because these statements I'm making, they are for healthcare providers, but we are not the only ones that are dealing with the population. Even at home, you may not be a healthcare worker. You are just a relative. But you need to be a caring relative. If somebody is a bit off, not participating, not getting involved, not, you know, aloof, I don't know why I'm in this family, nobody likes me. We need to dig deep. Don't just say, she likes to talk like that, or he likes to. Call the person to the corner and say, no, what's going on? We are a family, you know.
I really like that. I think you know, if those small concerted efforts could go a very long way. If you know, a medical doctor can pick something up and refer it, you know, to a psychiatrist or a psychologist, etc. You know, I think will definitely go a long way in dealing with these issues.
And even the people themselves that may be thinking of suicide. I don't believe that somebody is hated by everybody. So we used to say, you cannot be hated by all, and you cannot be loved by all. So there must be someone in your family, at workplace, a professional colleague, friends, you know, that you trust. You must find that one person that you trust and start talking. Speak out your mind. Don't die in silence. 80% of the suicides in men. Why? Probably because men don't cry. Men must not cry. No. I'm asking the men, please cry.
Very well, doctor. This year we'll cry.
Please
Thank you so much for being here, doctor.
And
all the best with the work that you're doing.
Thank you.
Thank you for here and sharing your insights on this very important matter.
Thank you. And have a great day.
Thank you. There you have it. Dr. Cornelia Ndifon, general practitioner, talking to us this morning, saying, please, man, we should learn to cry. It's okay to cry. As of course, we discuss suicide, a very topical matter, and she wants to see change in this year from the government, from the people, from us as a people as well, playing our parts and supporting each other where we can. So let's please rid our society of this ill. To stay with us, we have more interviews.